talking about painful sexual intercourse. I have a couple of women sending me messages on Facebook, and anytime they do, I'm like, I'm not a sex therapist, so I'm just a medical doctor. Well, I can also talk about cases like that. So dyspareunia, that's what we call it medically. We're going to talk about the causes, the types, and what brings it about, and how we can help such women. I've also been in that situation. Maybe your wife or someone you know, your colleague, a friend, tell them to come watch this video. Let's break it down. This is Boss Family Ghana. If you haven't subscribed yet, please do so. See ya. Time with Dr. Adams. Hi there. My name is Dr. Adams. You can call me Abigail, you can call me Irabna Adams. I respond to any of it. Alright, so this is my channel. This is your first time coming here. So grateful. Please do not forget to subscribe if you are a regular customer. Thank you. Anyway, so today we are talking about a condition that affects 3 out of 4 women. Yes, it's that serious and it's that common. And me personally, I don't really see it as a problem since it can easily be solved. It's just that people feel shy to come to the hospital or complain about such a problem. But please don't. Someone like me, I had it and I'm glad it's gone. So let's talk about this. What's painful sexual intercourse, or medically dyspareunia? It just means someone who feels pain before, during, or after having sexual intercourse. Medically, we say that there are 2 types of this condition. We have the primary and we have the secondary. Primary means you've had this pain from your very first sexual intercourse, and that's where I fall under. Yes, I've had primary dyspareunia. And then we have the secondary. Secondary is you've had sexual intercourses so many times, or let's say more than once, and then suddenly you start feeling pain in your subsequent ones. It means there is an underlying cause. All right. Then we also have what we call superficial and deep. Superficial means the pain is just around the vulva or the entrance to the vagina. But when we say deep dyspareunia, it means that during, let's say, deep penetration, sexual penetration, that's when you really do feel the pain. So remember I talked about us having either you have superficial or deep pain. So the superficial, usually it happens to people who are virgins. I've shared on my channel a couple of times that I married as a virgin, so it's normal. Because after I shared this experience, I've had lots of people coming to me, even the men, asking me that I'm going to marry a virgin, or I'm going to marry someone who's not had sexual intercourse in a long time, and the person is worried about pain. Of course, there's going to be pain. Just imagine the place is tight, nothing of that sort has entered before, and then suddenly something is going to enter. So entry pain, yeah, we have that one. There are people who also have pain after they've started menopause or after childbirth. Then again, I also fall under that category. After childbirth, I have 2 kids. After childbirth, I experience pain as well. It gets better along the journey. We have people who have that kind of pain after they've had a form or sort of trauma around the pelvic region. Maybe you had a surgery, or even when you went to give birth. You know, when you have vaginal delivery, sometimes Obibeka say me hot or they had a tear and it was sutured. So after that suturing, of course, when you're going to start sex all over again, it's going to be painful, and that is not normal, but then it's something we usually see. So causes of the deep dyspareunia can be pelvic inflammation disease. It can be fibroids. I'm sure you are surprised. Yes, if you are having pain, and then the pain usually happens when it's not when the penis is entering the vagina, but then during the deep sexual intercourse you feel that pain. It could be fibroids, it could be endometriosis. All these are medical gynecological problems. It could be adhesions. So when it comes to the management, if your pain is not primary is your first sexual intercourse, you have that pain. If your pain just happened when you had first sexual intercourse, that's okay. Like I said, because nothing has entered before and is entering, that is normal. With that, we usually advise that you make sure that your sexual arousal gets really high before there is penetration. We usually encourage that the foreplay is more before penetration, because we know that during foreplay and during the excitement of sexual attention and all that, the vagina gets wet, so it makes it easier for the penis to penetrate. So sometimes it could just be vaginal dryness, and whether there's cream, all you have to do is just visit the hospital. It's very, very important that we visit the hospital, because apart from it being primary dyspareunia, if it is a secondary causes, it means you need a gynecologist to help you out. Do you understand? Don't stay at home and feel shy. Don't go to the doctor and think, your problem cannot be solved or it's too embarrassing. Please, 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 please. That is why we are paid to listen to all these problems. Come and let's talk. So if it is any of these gynecological issues, uterine fibroids, endometriosis, adhesions, polyp, uterine prolapse, all these things can be helped. And it will even better your life. Apart from it bettering your sex life, it can better your life as a woman, and you might probably be having other symptoms that it will solve. But if it is the other issues like just dryness, there are creams to help, KY gel and other estrogen creams to help. And then sometimes it's just stress. You just need to relax. This is where, when you're talking to the person, you need the partner to also be there. The men, don't just complain about the woman and be always complaining about sex or always saying that it's painful. Take time. Sex starts from the mind. Sex starts from the mind. Start sending each other text messages whilst we are both at work. Leave short messages. Give clues to tell her that you're going to have sex this evening. Start with something nice. It just shouldn't be penetration. Find out if she enjoys foreplay more and concentrate more on the foreplay. Let her know you are just not into the penetration, and that's it. Something that she also enjoys. Sometimes it could just be emotions. She's very tired. She's had a child. There are so many things to do. Help with the things at home. Now you help with the things at home. She's more relaxed. There's nothing really bothering her emotionally. She's not stressed. She can enjoy it. Also, find out the history of your spouse. Did she have a terrible, terrible, terrible past? Maybe her ex was abusive. Maybe she was raped in the past, had a bad sexual experience, something. Get interested, because management of these cases or these conditions are always connected to the causes. All right. Before ending, I just want to say, I think I mentioned that example of moisturizers you can use, KY gel. Please do not use petroleum gel. Before you go and use petroleum, and so please just get the right things for the right job. One more thing. What about changing environments? It works. The mind is such a beautiful place. If someone is relaxed, if someone is in a happy place. I remember someone telling me when she's having sex, she likes hearing the sound of the ocean. Sounds weird to me, but that's what she likes. So when she's having intercourse with her partner, she usually plays YouTube audios or videos that have that. Just imagine that kind of person if you send her on a weekend away by the beach. Super, right? Yeah, some of these things can be easily solved. Just sit down. Sex is not just one person. It takes two to tango. Sit down, talk about it. I'm having this problem. Let's solve it this way. This is the problem. Let's do it. And men, please be patient. Please be patient. If you've not watched my video on my first sexual intercourse, I talked about how my husband was really, really patient with me, and then we had a walk in the park. When I say walk in the park, we walked through the issue together. And even after childbirth, I had the same issue because I also had a tear and I was sutured. So be patient and just know that this too shall pass. It's not a condition that you should live with forever. If medically we can help you, please come. If not, partners help each other. If you have any questions or there are anything you also want me to know, whatever helped you, please let me know in the comment section below. It takes two to tango. And remember that sex was created by God to be enjoyed by married couples. So whatever you do, make sure you're enjoying it. This was Boss Family Ghana coming your way. Please do not forget to subscribe. Thank you. bye.